Hi everybody, welcome to Healthline. I am Gregory Zarian. The entire conversation is all about colorectal cancer. Did you know that colon cancer is called the silent killer? Here's a few facts for you. Excluding skin cancers, colorectal cancer is the third most common cancer diagnosed in men and women in the United States. The United States Cancer Society estimates for the new number of diagnoses this year in 2016, close to 95,000 will be for colon cancer and over 39,000 for rectal cancer. Those are staggering numbers. However, I do want to share with you that since 2009, the new cases of colon cancer and rectal cancer have dropped significantly, and I will share with you those numbers. So joining us today is Dr. Robert Yavrouian from Glendale Adventist Medical Center. He's a specialist in colon and rectal surgery. How are you, doctor?
Good, thanks for having me.
Welcome back.
Thank you.
We've been to this party before. Doctor, I just want to top this off quickly. The numbers have gone down. Why is that? Because we did a study earlier that 2009, they were over 50,000. Now they've dropped. Why?
I think there's an increased awareness
Love that.
In the U.S. People are becoming more aware of how easy it is and how important it is, and doctors are pushing it. So.
They're pushing for early detection.
Yeah.
Do you think that when we hear that if you go in for early tests and stuff, people are more adamant to get tested and checked?
I think so, and I think a lot of it is related to TV, social media, et cetera, and just people being more comfortable with the research that they do online, finding out how simple it is and how important it is. Yeah.
But also don't you think that when I love that you said social media, that most people will put, you know, my mother passed away from cancer, and then my father had this, my sister had this, and I've lost this, and I've gained in regards to weight and all this stuff. Do you think people look at it more as an affair of the heart, and that more people tap into, oh, this has touched my heart, I'm going to pay attention and then pass on a story to my family?
Yeah, I think that certainly plays a role, yeah.
Third leading cause of cancer deaths. Why is it called the silent killer?
Because there's no symptoms. Often you can have a colon cancer or rectal cancer and have no symptoms like pain, weight loss, etc. It may not be present.
Why is that? I mean, is there, because I know with breast cancer, a woman has a lump. There's signs and symptoms. Testicular cancer for men, even.
So it's an organ that you can't feel by touching
Okay.
yourself on the outside, and because it's a slow process. So these tumors start as small benign polyps, and gradually over the course of years do they enlarge and potentially spread. So those are the main reasons why it can be potentially silent. And
there are no symptoms I mean, I know you said weight loss could be a possible symptom.
Yeah, probably the most common symptom is bleeding.
Okay.
But not everybody has bleeding. That's why we have to screen. That's why screening is important. Screening means that a patient has no symptoms. We're doing this as a preventive measure to try and find a problem and take care of it sooner rather than later.
You know, you were saying bleeding, and we're going to wrap out into our first break. So just say somebody bleeds from the rectum. If it is associated to colon cancer, would it just be a heavy blood flow, or would it be spotting?
No, it can be anything. It can be blood that's just microscopic that
Okay.
you wouldn't be able to see with the naked eye. That would have to be tested
Okay.
by your doctor, or it could be, bleeding that's bad enough to make your toilet bowl water red.
If that, just say on a random Wednesday, you bleed rectally, and then it doesn't happen again, is there cause for concern? Should you call your doctor, or it could just be, you know what, this just happened and I'm fine?
No, bleeding should never be ignored.
Okay.
You should always get it checked out.
I love that. Thank you, doctor. Don't go away. More with Dr. Yavrouian and colorectal cancer when we come back. Welcome back to Healthline. The entire conversation is all about colorectal cancer and how to take care of your colon. Joining us is Dr. Robert Yavrouian from Glendale Adventist Medical Center. Doctor, before the break, you just touched on that, a big sign is a full toilet bowl full of blood. Are there any other maladies that could be associated to that?
Yeah, there's a host of problems that can cause bleeding, both in the lower GI tract, which is the colon, and the upper GI tract, which is the part upstream from the colon.
But so upper, because we had a Dr. Frederick Bogosian on here, and he spent a lot of time talking about the GI tract. So upper is from the esophagus to the...
Yeah, from the mouth to just past the stomach.
Okay, that's the upper, and then lower is the stomach.
All of the small intestine
Okay.
and the colon.
So other types of bleeding could be...
Hemorrhoids.
Hemorrhoids.
Other proctological
Okay.
problems like fissure,
Okay.
colon polyps, colon cancer. There can be blood vessel abnormalities inside the intestine called AVMs, which can bleed. Diverticulosis can bleed.
So
There's a lot.
So no matter what, if you one day have a toilet bowl full of blood, call your doctor.
Yeah, should never be ignored.
Never be a bit of random spotting. Could that just be, maybe it's a hemorrhoid, maybe it's this?
You never know when a hemorrhoid is just a hemorrhoid or when
Okay.
it could be something else. So you got it. And seeing a doctor is critical.
So if there's anything that's different, and if there's any appearance of blood, call your doctor.
Yeah.
Okay, so colon cancer, rectal cancer, anal cancer, they're all in the lower GI. Are the signs and symptoms the same for all of them?
They can. There is a little bit of symptom overlap in
Okay.
terms of bleeding.
Okay, bleeding.
But anal cancer is very different from colon and rectal cancer. So anal cancer is just the very last portion of the GI tract, just the opening, and cancers there are related to a virus.
Okay.
Whereas colon cancer and rectal cancer all start as small polyps, which then grow to and then change into a cancer. That's completely different from
Okay.
anal cancer.
So it goes anal, rectal, colon.
Right.
Colonoscopies. So over the age of 50?
Starting at the age of 50, if you're at average risk, meaning no family history of colorectal cancer and no personal history of polyps.
So no matter what goes on, and I've said this 1,000 times on this show, talk to your parents, talk to your grandparents, talk to your family about everything and anything in regards to family history of any type of cancers, any type of physical ailments, high blood pressure, low blood pressure, everything.
Right.
So somebody goes in for a colonoscopy. They're all afraid of the prep. Can you share with us to let go of that fear and just have a day and a half?
Yeah,
It is what it is.
the prep is not pleasant, but it's part of the deal. The good thing is there are some low volume preps that are
That's right.
available, so you don't necessarily need to drink the 1 gallon to get clean. There are some alternatives which are less unpalatable.
And mint flavor and cherry.
Yeah.
And orange if you're nice. So someone comes in and you find polyps. Benign means they're not cancerous. So just say someone is diagnosed with colon cancer. What is the protocol? What happens?
So once the diagnosis is established, then you need to get staging studies and blood tests.
Okay.
Staging studies usually involve a CAT scan
Okay.
of the chest and abdomen and pelvis. It may also include a PET scan depending on the situation.
Why the chest and the pelvis?
Uh,
In case it's spread?
right, you're looking for areas of spread, so the liver, the lungs, and some of the lymph nodes
Okay.
around the colon and rectum. So this is standard for anybody with that diagnosis. And then once you have a pre-op stage established, then you move on to the next phase of treatment, which in most cases is surgery.
Is it standard? Because I had a colonoscopy a couple of years ago. As we discussed, my father passed away, and I took an antibiotic. It wreaked havoc on my system. They found a couple benign polyps. Is it common for people to just, like my older brother had one, and so did my twin. We all had polyps. Is it common for people to just have benign polyps in the rectum?
They are common. They're common, and this is why we advocate for colon screening, to find small polyps and remove them before they grow or transform into cancers.
Why is it common?
Well, it's related to genetics, and probably a lot has to do with environmental factors, things that you eat, things that you're exposed to either in your daily practice or work, etc.
Smoking, alcohol, all of that.
Yep.
Yeah, and it's interesting too because that all three boys had polyps in around the same area, and our father passed away from myeloma, and he also had prostate cancer.
Yeah.
Prostate cancer isn't connected to any of this, is it?
Prostate is not, no.
Okay. Just and one thing we've talked about a lot on Healthline too is to go get your prostate checked, guys.
Yeah. Yeah, prostate is
well-
the neighbor. It's the neighbor right in front of the rectum, so it's important to get that checked too.
Okay, I love that analogy. Okay, guys, talk to your neighbor, get checked. Okay, there are quite a few surgical options in regards to a diagnosis. Are the surgical options the same for men and women, or do they vary depending on your gender?
The surgical options are the same. Yeah.
Okay.
It involves basically removing the segment of colon that bears the tumor, along with the blood vessels that supply that segment of colon and the lymph nodes surrounding it.
One of the surgeries that we're going to talk about today, it's called the open surgery. What is that?
So open surgery is the traditional tried and true technique that's done under general anesthesia through a big incision, where the surgeon just opens the abdomen and gets his or her hands in there and treats the issue.
Is a lot of the colon removed in an open surgery, or is it just the infected parts or the cancerous part?
It's usually just the section that bears the tumor, just the cancerous part, right?
So then, do they just take out that part of the colon? Do they rebuild it with something else?
No, once that part is removed, then the part of the intestine immediately upstream is connected to what's left of the colon.
Because don't we have a lot of extra intestine?
Right.
So I mean, it's kind of like God gave us extra intestines just in case we
Right.
needed backup.
Yeah, it's just the easiest analogy is it's like plumbing. So you are removing a section of the pipe, and then the upstream end and the downstream end are reattached to one another.
And then it just it's kind of like cutting off a lizard's tail, yes? That it just I'm looking for a word and I can't.
The two ends just heal together.
They heal together.
Yeah.
Hold that thought. We're going to talk about the two ends healing together and other surgical options with Dr. Yavrouian and colon cancer when we come back. Don't go away. Welcome back to Healthline. The entire conversation is all about colorectal surgery and rectal surgery and colon rectal cancer. Joining us is Dr. Yavrouian, and he was just sharing with us about what traditional open surgery is when someone is diagnosed with colon cancer. It usually requires a long incision, and you said, doctor, that it's going through the abdomen.
Right.
Is that who gets the open surgery? The standard, let me cut you open and go in there.
Yeah, it's a complicated answer, but a lot of it depends on the reason for surgery and the problem that's being dealt with. Certain diagnoses are not appropriate for laparoscopic surgery, which is the alternative we'll talk about later. But
Yeah, because we'll talk about laparoscopic, we'll talk about the robotic surgery as well. You decide to do open surgery on someone. Why, as per?
the most common reason is because they've had a lot of other surgery before, and there's scar tissue internally that can only really safely be approached by having your hands in there to minimize the risk of other problems.
So actually being in there and being more tactile.
Right.
So it's more of a surgical choice when it's like a repeat.
Redo surgery.
A redo
It's typically
surgery.
done open. Right.
Redo surgeries in that area could be from intestines to gallbladder to all of that.
Exactly.
Okay, so that's why somebody gets a long incision. What's the recovery time on that, doctor?
Usually it requires about 5 to 7 days in the hospital.
Okay.
And then recovery continues at home depending on the patient's baseline status, but can continue for up to 3 months at home.
Up to 3 months, and then is there physical therapy involved?
Depending on the patient's overall physical condition before surgery. But
And earlier you talked about stages. Someone with stage 1 colon cancer, would they have the open surgery if it's a redo?
if it's a redo, then typically it would be done open. But if it's somebody who hasn't had surgery before, then a stage 1 tumor can be treated laparoscopically.
Speaking of laparoscopic, doctor, what is that?
So laparoscopic surgery is done using a camera and small incisions to do the same operation, to take the tumor out, to take out the segment of colon that bears the tumor along with the lymph nodes. But it's done through small incisions. Ultimately, a small incision does need to be made to take the specimen out, but that incision is a lot smaller than open.
The open.
The open. And the advantage of laparoscopic surgery is pain is less, scars are fewer and shorter.
Recovery time
and
is
recovery
shorter.
is faster.
On Healthline, we've talked about the SILS, the single incision laparoscopic surgery. Is this the same thing or is it different? And that goes through the belly button.
Usually, yeah. So SILS is also laparoscopic surgery, except the instruments all go through one incision rather than multiple incisions.
In your procedure and technique, would it be multiple incisions or just one?
I do multiple incisions.
Multiple incisions. Is that just to make sure that you get everything, or it's just easier to?
It's just my own personal preference.
Now, why would you choose? I know you were saying earlier about a redo procedure. Who's a candidate for the laparoscopic?
Typically, it's patients who haven't had too many operations before. Early stage tumors, small tumors that aren't invading into other things nearby.
So early stage meaning 1 going into 2, 3, and 4, 2 advanced?
Yeah. Yes.
So do you get more laparoscopic surgical procedures with men over women? Is there, or is it all the same?
They're equal.
Because I know women, we've talked a lot about that women are really worried about the scars. Men are like, yeah, it's a war wound. Like, I have scars. So it's a war wound, and it's my testament to time.
In my experience, it's equal across genders.
So what is the recovery time for laparoscopic?
Typically, hospitalization is 2 to 3 days.
Okay, so it's half.
Yeah.
And what about physical therapy?
It's less likely to be needed. Your return to baseline function is much faster with laparoscopic surgery.
There's another procedure called the robotic procedure. But I have a question before we talk about the robot, doctor. Stage 1, beginning, stage 2, 3 and 4. Talk to us mortality rate in regards to that.
Stage 1 has a greater than 90% 5-year survival rate. So that means that after 5 years, 90% of patients with stage 1 cancer will still be alive. Stage 2 is closer to 80%.
Okay.
Stage 3 means that it's spread to the lymph nodes. 5-year survival is typically around 60%. And these are patients that are candidates for chemotherapy. Stage 4, 5-year survival is around 20%. The average survival for a patient with stage 4 colon and rectal cancer is about 20 months.
Wow, so early detection and go to the doctor. What's the youngest patient you've ever come across with colon cancer?
Teenager.
Teenager.
Yeah.
Hereditary?
Yes, in that case, yes.
One more surgical option is the robotic procedure. What is so different with that as per the laparoscopic?
So robotic surgery is a lot like laparoscopic surgery, except...
Is it the Da Vinci?
Da Vinci,
Okay.
yeah. So there's currently just one robot manufacturer, but it's a lot like laparoscopic surgery, except that the surgeon is seated inside of a console and can manipulate robot arms, which are then connected to instruments inside the body, laparoscopic instruments that do the same function as if your hands were inside there.
Why would somebody choose the robot over laparoscopic?
Again, it's a personal preference. The robot...
Personal preference between the doctor or the patient?
The patient and the doctor. It's an area of controversy in my line of work. The robot is a tool. Just think of it as a tool to a means to reach an end. So it's a tool that a surgeon uses to do the operation, but it has not been proven to be better than the laparoscopic technique in any measurable way.
It just goes into a personal choice.
Right.
Thank you, doctor. More with Dr. Yavrouian when we come back. Don't go away. Did you know that it is suspected that there will be over 49,000 deaths this year due to colon cancer? As I said earlier, it has dropped quite a bit. In 2009, over 52,000 people died, and it is estimated that this year, 2016, 49,000 people will die. Joining us is Dr. Robert Yavrouian from Glendale Adventist Medical Center, and he shared with us that it's all about early detection and social media, conversation, people talking in a public forum about what's going on in their health. Doctor, so we talked about the robot, we've talked about the surgical procedure, laparoscopic surgery, and then the open surgery. What are your thoughts on all of that?
I think, a surgeon these days with technology, it's so nice to have multiple techniques available in your toolbox to treat a problem. I think when you're a patient and you're faced with the decision of having to go through surgery, sometimes you can be a little bit overwhelmed by the different things you read online, et cetera. I think the important thing is to find a surgeon you trust and to allow them to do the operation that is best in their hands for you. So whether it's open surgery, laparoscopic, SILS, or robotic, try not to pigeonhole yourself into one particular technique. Just let the surgeon go over the options with you and offer you what's best for you in their hands.
Do you feel that it's also a family choice as well, that patients should talk to their family and say, what do we feel is best? Because at the end of the day, it's also the patient and the doctor's decision, but it's also a cancer. It's not just about the patient, it's about the family and the friends.
Absolutely. I think having good family support is critical.
And so lots of conversation. In regards to somebody coming in, having colorectal surgery, and their entire life has changed. A lot of people walk out of there having to have a colostomy bag. What do you say to somebody that is at that stage? How do you tell them to not give up and just get their life back?
Well, that's a delicate conversation, but I think
it's a factual conversation.
It's a factual conversation. I think having, if you're referring to the colostomy, so having a colostomy is not the end of the world. There's people in the NFL who have had colostomies. There's many professional athletes who've had them. You probably walk across the street and have shaken hands with people who have them. It's not a death sentence by any means. It is a dramatic change in your lifestyle, but it's not the end of the world. There's a lot of online support groups and online information from reputable sites to help educate a patient before surgery about what to expect with a colostomy. Both the hospitals that I work at have enterostomal therapists who are trained nurses that help educate and teach a patient how to take care of a colostomy, both with pre-op expectations and helping them in the hospital as well as transitioning that care to home.
I love that you said that, and it goes back to what we were talking about earlier about, there's social media. You are not alone. All you do is put something in the Google search and you will find other venues. Prevention for colon cancer, doctor, rectal cancer. How does somebody prevent this?
So there's several, but diet, so high fiber, low red meat diet is important. Aspirin and vitamin C can have some preventive effects, but really all those things pale in comparison to just getting a colonoscopy. That actually has the most bang for the buck, so to speak. So you're going to be much more successful preventing a colon or rectal cancer by getting a colonoscopy than by any other means, all other means combined.
From the age of 50 on, unless there's family history?
Unless there's a family history of it, in which case it should start 10 years before the age of diagnosis of the first degree relative.
Before we have to wrap out, what is your one wish for people in regards to their lower GI tract and health? I know you were saying fiber, I know you're saying, aspirin, red meat. Well, what is the one thing that we don't do that could help us be healthier?
I think...
When I say one thing, I know there's quite a few things.
Yeah, there's a lot of things, but I think the most important thing is if you have a symptom, get it looked at, get it checked out, whether it's pain, bleeding, weight loss, bloating, constipation. Just don't ignore it. Don't let it go on for months, years, etc.
Do you find that most men will hide their symptoms, as per women?
Men probably more than women.
Because I know, as we've discussed before in regards to prostate cancer, there's definite signs and symptoms. The inability to stay fully turned on, the constant, the chronic urination at night, and they don't talk to their partners, they don't talk to their family members, and then you go to the doctors and you're stage 2
Right.
of something.
Yeah, don't. Yeah, I mean, if you have a symptom, that's why colon cancer, being the silent killer, can kill you without symptoms. So if you have a symptom, you can't ignore it.
Final thoughts, doctor, in regards to any of this?
Eat healthy, diet, exercise, and get a colon.
What is? I know you said high fiber. What is high fiber?
So high fiber is 26 grams a day of water-soluble fiber, like psyllium, for example. So it's really hard to do with diet alone. So typically a supplement of some sort is needed.
You can get psyllium husk.
Yeah, you can get psyllium husk.
There's something great called Colon Care.
Over the counter,
That I'm a
things like
fan of.
Metamucil or Consol, which I have no financial relationship with whatsoever.
Which we are not making any money off saying colon care or psyllium husk, yet it does save lives.
Yeah.
Because isn't it true though also that our bodies are like a car, and the better you treat your car, the more you flush out the radiator, the generator, the more you keep it clean, the better off it runs.
Absolutely.
The more we keep ourselves clean. Before we head out, obesity in this country, is there a big connection to obesity and colon cancer?
I'm not sure that there's a known scientific direct link, but obesity affects so many other organ systems, diabetes, high blood pressure, sleep apnea, etc., that it can be a marker for poor outcome if you do have that diagnosis.
Yeah, I'm an advocate of, I say this a lot on Healthline, that I've lost over 30 pounds, and I'm an advocate of getting your health on. And the fact that we live in the United States and we are considered the most obese country in this world is tragic to me. Doctor, thank you for saving lives.
My pleasure. Thanks for having me.
Will you come back again?
Absolutely.
Okay, so you heard it. High fiber, a lot of exercise. One thing the doctor and I discussed during one of the breaks is stay away from processed food. Instead of driving through a drive-through, go home and make a healthy dinner. As we talked about here on Healthline, shop on the outside of the market, lots of fruits and vegetables, and stay away from a lot of things that are packaged and unhealthy for you. And the number one thing you need to do is go get a colonoscopy. Remember, the most important conversation you are going to have is about your health. So why not have one today? Thank you for joining us on Healthline. We will see you next time.